Urinary tract infections, UTIs, are truly a nightmare for many people, as they cause burning pain and severe discomfort during urination. Today, join me in exploring some basic information about urinary tract infections. This is one of the most common diseases related to the urinary system. It can seriously impair a patient's quality of life and lead to dangerous complications if not diagnosed and treated properly. First, let's briefly look at the structure and function of the urinary system. The urinary system consists of the following organs: two kidneys, two ureters, the bladder, and the urethra. The kidneys function to filter blood and remove waste products, protein metabolites, and electrolytes to form urine. The ureters are two tubes, about 30 cm long, connecting the two kidneys to the bladder. Urine passes through filtration tubes in the kidneys, becoming gradually concentrated, and flows down to be stored in the bladder. At the end of each ureter, there is a one-way valve that prevents urine from flowing back into the kidneys. When the bladder is full, reflexes cause the bladder wall muscles to contract, sending a signal to the brain to create the urge to urinate, signaling us to release urine out through the urethra. Under normal conditions, urine is completely sterile. The presence of bacteria in urine is evidence of a urinary tract infection, UTI. It can be seen that a UTI is an infection involving one of the parts of the excretory system caused by bacteria. So, what are the specific forms of urinary tract infections? UTIs are relatively common infections in the community. Classification by anatomical location: it can be divided into two types: upper urinary tract infection and lower urinary tract infection. An upper UTI means infection from the ureters up to the renal pelvis and kidneys. A lower UTI is an infection of the bladder and urethra. For men, it can also include prostatitis. Classification by duration: UTIs can be divided into acute and chronic types. Classification by severity: it can be divided into uncomplicated and complicated UTIs. Uncomplicated UTIs are mild and occur only in the bladder or urethra. Complicated UTIs are severe cases where the infection may spread to the ureters and renal pelvis, potentially leading to kidney inflammation, nephritis, and serious complications. So, what are the causes of urinary tract infections? First and most common, ascending infection, retrograde infection. This means bacteria invade from the outside into the urethra and bladder via the external genitals and can spread up to the kidneys and renal pelvis. Second cause, hematogenous infection via the bloodstream. This occurs when bacteria travel through the blood to cause a UTI. This is a severe case because when bacteria enter the blood, they usually have already damaged other organs. Third cause, infection via the lymphatic system. Fourth cause, direct extension, local infection. For example, if a patient has an appendiceal abscess and the location of that inflammation is very close to the urinary tract, it can directly cause a UTI. Fifth cause, this is also relatively important and common. It occurs when, for some reason, a patient must have urinary catheters inserted, which can also lead to a UTI. So, which groups are at high risk for urinary tract infections? First are pregnant women. During pregnancy, as the fetus grows, it compresses the ureters, which can cause a UTI. Patients with compromised immune systems, or those who must use immunosuppressive drugs for a long time. Patients with diabetes. Stroke patients who are bedridden for long periods are also very prone to urinary tract infections. Women generally have a higher risk than men. This is due to female anatomy. Specifically, the urinary tract is very close to the anus and rectum. Therefore, bacteria can easily invade the body through the ascending pathway. What are the general symptoms of these urinary tract pathologies? The patient will experience fatigue, high fever, shivering fits, and bad breath. Second is pain, abdominal pain, or pain in the flank tuck lower back area near the spine. The pain is usually dull, with a sensation of pressure or heaviness in the lower back. Third are urinary symptoms: dysuria, painful urination, urinary frequency, leading to a constant urge to urinate, and cloudy urine. So, what are the methods to treat urinary tract infections? Depending on the severity of the disease, appropriate treatment plans are provided for each patient. If the patient only has a UTI with simple common symptoms, The doctor may prescribe oral medication for home treatment after the examination. However, in severe cases where patients show clinical signs like high fever, or if accompanied by specific causes like stones or tumors, doctors will require hospitalization for monitoring and treatment. To treat UTIs, doctors typically prescribe antibiotics. For mild infections, oral antibiotics are used, but for severe cases, doctors must administer intravenous antibiotics. Besides treatment, it is necessary to ensure proper nutrition and electrolyte balance, as well as boost the patient's immune system by supplementing minerals and vitamins. Additionally, urinary antiseptics can be used in combination. An important point is that doctors will investigate to find the underlying cause of the UTI for treatment. For example, if the cause is kidney stones, lithotripsy, stone breaking, may be needed. If the cause is an abscess, the doctor must drain or eliminate the abscess. Only by resolving the root cause can the condition be stabilized. If not treated promptly and correctly, urinary tract infections can lead to complications and more severe infections, such as sepsis, blood poisoning, septic shock, and multi-organ failure. Here are some drinks and foods with diuretic and antibacterial properties that are very good for people with urinary tract infections. Drink enough water every day. Fruit juices like carrot, blueberry, strawberry, and passion fruit help dilute urine, increase excretion, and flush bacteria out. Baking soda. This is a very good drink to support UTI treatment, helping to neutralize acid in urine and reduce burning pain. Eat plenty of vegetables and fruits to supplement vitamins and fiber to strengthen physical fitness, such as celery, watermelon, pears, grapes, and winter melon. Whole grains like corn, mung beans, and onions can help reduce symptoms of frequent and painful urination. Ginger and garlic. These contain natural antibiotic compounds that limit inflammation and boost the body's resistance. Although not always a critical disease, urinary tract infections are truly a nightmare for many people because they cause burning pain and great discomfort when urinating. Therefore, as soon as the first symptoms appear, such as painful urination, blood in the urine accompanied by fever, or pain in the lower abdomen, please quickly visit a medical facility for diagnosis to limit the risk of complications. If you found this useful, please share it so everyone can know. Thank you for watching and see you in the next video.